male admitted to emergency room with fall. He lives with his wife and still works as a restaurant manager. So he is an active person. He has a past history of the benign prostatic hyperplasia or benign hyperplasia of the prostate and currently taking tamsulosin. He is otherwise fit and healthy. On examination, there is a right hip tenderness on movement in all direction. In hip X-ray, confirm a intertrochanteric fracture. So, what is the best management option? That means, in case of intertrochanteric fracture, what we will have to do, or what is the definitive management of the intertrochanteric fracture? Here, the options are cemented hemiarthroplasty, total hip replacement, dynamic hip screw, percutaneous pinning, and leg traction. So what may be the option in case of intertrochanteric fracture? In a patient who is 60 years old and he is generally fit but taking the tamsulosin causes the postural hypotension, probably the patient fall in this condition. Here this is the hip joint, which is the femoral head and acetabulum, and this is the greater trochanter, lesser trochanter, neck of the femur, and the fracture occurs in the intertrochanteric line. So what is the management option? So in case of intertrochanteric line, what is the management option? Is the fixation, internal fixation, or which is the best option? We have to see. Now here this is the fracture, which is the intertrochanteric fracture, and we can see a device is introduced in the femur. Actually it is outside the femur and inside the neck of the femur, and finally goes to head area, and this device is not and the dynamic hip screw. It is the dynamic hip screw. There is the another version. Here we can see this is the hip screw, but in this condition the nail is inserted, or other part of the hip screw they are inserted into the medullary cavity, but in the first picture it is the outside the medullary cavity. Now see the peritrochanteric fracture. Our concentration is here, which is the peritrochanteric fracture. In case of peritrochanteric fracture, what is the absolute management? In case of the intertrochanteric, that means from the greater trochanter to lesser trochanter, that means from here up to here. As this is the greater to lesser trochanter, that means the intertrochanteric fracture. In this condition, in case of stable and unstable, in both cases there is option for dynamic hip screw, DHS. It can be done. That means the dynamic hip screw, it can be done in case of the internal intertrochanteric fracture. On the other hand, is the fracture is reverse oblique and severely unstable. In this condition, intramedullary nail inserted. So most of the case of the peritrochanteric case, they are fixed by the dynamic hip screw. On the other hand, there is subtrochanteric. That means there is below the trochanter, below the lesser trochanter, this area when it fracture, the definitive management is intramedullary nail. So the two options, one of them when it is peritrochanteric or intertrochanteric, it is dynamic hip screw. When subtrochanteric, usually intramedullary nail. So what is our answer? Intertrochanteric fracture. In case of intertrochanteric fracture, it is the dynamic hip screw. Other option here, such as the cemented hemiarthroplasty. Hemiarthroplasty, it is done in case of the femoral neck fracture, and in case of the patient who is not fit for a longer time of the surgery or who is bedridden. In this condition, hemiarthroplasty is the best option. On the other hand, the total hip replacement, it also done in case of the femoral neck fracture, but in this condition the patient is typically healthy, fit for acting different activities. In this condition, dynamic hip screw usually placed. Percutaneous pinning in this bone, which lies superficial to, that means the very close to skin. And the leg traction, actually this treatment is obsolete because most of them we want rapid recovery. In case of the leg traction, there is a longer time requirement for the cure. For this condition, leg traction usually not done. So now for intertrochanteric fracture, dynamic hip screw is the best option.